Hey everybody, it's Dr. Roach here. We're going to go through a video on pediatric distal femur insertion. There's been a lot of discussion about this, so we're putting this video together to help facilitate the training. Here you can see them coming with two fingers to palpate just over the patella to determine the depth of tissue. Don't look at the two fingers as a marking of distance. It's 1 centimeter above the patella and 1 centimeter medial would be your location for insertion. After you clean the insertion site, then you're going to take your needle, and as you can see, you want to see the depth of insertion. So if you look at the blue needle has 25 millimeters or 2.5 centimeters. And as you can see there, that needle will be too short. You want to make sure that the needle, there's the black line, which is the 5 millimeter line, is sticking out of the tissue. That's how you know the depth. So there it is, the puncture through the skin, touch the bone, make sure that there's a 5 millimeter mark that's still exposed outside of the skin, and then you know the depth, the needle is the correct size. I'll talk about needle size later, but let's just get through this video. Now you stabilize with your hand, remove the drill, counterclockwise, pull out the needle, put that into a sharps container. Now you're going to put the dressing over that, come in, clear the line with saline. It's ready now to attach. Now, when you aspirate back at this point, after you secure the line, you're going to aspirate back to see blood. If you see blood, that's great. If you don't see blood, that does not mean that you're not in the proper location. Flush with 3 to 5 milliliters of saline, and then you can also recheck then to see if you have blood return. Secure the line so you don't pull this out. Now, to remove it, you're going to go counterclockwise, pull off your line and syringe. Then you attach the syringe to that. You're going to rotate it clockwise and directly pull straight out. You're not going to wedge it back and forth. You just pull one clockwise turn and straight out. Okay, so that's basically the distal femur, and that's the best location for pediatric patients. We want to make sure everybody is flushing the IO line once it's placed. So you're going to flush pediatric lines with approximately 5 milliliters of saline, and then look for aspirate back, look for blood return. On adults, 10 to 20 milliliters flush. And then again, aspirate back, looking for blood return. The next thing is distal femur proximal IO. So the age range is about 10 years, up to about 10 years old for the distal femur, and then once they get 10 to 12 years old, in that time frame, proximal humeral IO is the next best place to go. So up to age 10, we're going to use distal femur. After age 10, look for the proximal humerus. But again, as we always say in the protocols, this is a life-saving intervention. These patients are critical, so you get the line that is available to you. So we want to talk about needle size. So the manufacturer, you have the pink, blue, and yellow needles. So the size of the pink needle is up to 15 millimeters or 1.5 centimeters. And as you can see, up to 39 kilograms. The blue is 25 millimeters up to 40 kilograms. And the yellow is 45 millimeters up to over 40 kilograms. So the key thing is, it's not so much, these are guidelines. When you, as we said in the video, when you palpate and you see how much tissue is there, you can kind of estimate what size needle you're going to need. It's not saying that if they're 20 kilos, they have to have a pink IO. You have to look at it and use your judgment. So the key thing is, as we said before, the 5 millimeter line. That line should be above the skin. And if it's not, then you have the wrong size needle. So you may have to, in a pediatric patient, you may actually have to use the yellow IO needle depending on where you're placing the needle. The key thing is put the IO in, palpate the bone, and then look at your markers to make sure you have at least one 5 millimeter marker above the skin. We want to talk about patients that are still conscious and awake and will feel pain. These patients are going to require lidocaine prior to any large infusion. So the dose of lidocaine is 40 milligrams, and then you can repeat 20 milligrams. The way this is done in a 1% solution, it's 4 milliliters of a 1% solution or 2 milliliters of a 2% solution. But ultimately, the bottom line is 40 milligrams will be inserted into the IO very slowly. There is a misconception, and I've heard this described to me, where people think that they need to give lidocaine around the skin prior to the IO being placed. And that is not the case. I want to be clear. You're going to use the IO needle, as we said before, you're going to go right through the skin to the bone and drill right into the bone with no lidocaine. Once the IO is secure, you're going to insert the amount of lidocaine we just described into the IO, and you're going to allow that some time to anesthetize the bone marrow. And then, subsequent to that, you can do your infusions. This concludes the video on the IO training, specifically the distal femur IO. We showed you the specific steps to go through to place the IO. We talked about post-placement, flushing the needle, and as well as the age ranges for which location to kind of stress and focus on. I think this IO is a very valuable tool to facilitate resuscitation in critically ill patients. And I hope this video is helpful. Please give us feedback and let us know if there's anything else we can do to make your jobs easier. Thank you.